It's a brand new show that just dropped. While the presenters play dominoes, a special guest will be discussing all topics that matter to you. Everything from judicial, legal, health, wealth. Nothing is off topic. The name you ask me? Domino Effect. Domino Effect. Come listen. It's time well spent.
Good evening, good afternoon, good morning. Thank you for coming back. So this is part 2 of our discussion with about the urologist. So we are coming back so that we can discuss prostate cancer. To give you a recap, urologists are board certified physicians that not only perform as physicians, but they are also surgeons with 15 years of education behind them. So in our first part, we discussed what urologists do. We also discussed testicular cancer, getting tested for testicular cancer, and the works. So we've got Eves with us. We've got the Padre. We've got Sweet Will. And I am Nurse Pat, bringing you the info and the lowdown today. Just an FYI, we need another lady at this table because these guys, the stuff that they say, boy, you should see some of the behind the scenes. So,
Miss
fellas,
Cassie, we waiting for you. Yes, I'm putting you out there.
So, fellas, let's go and finish talking. What are the questions you had, the hot topics you had for prostate cancer? Sweet Will, what you got? You had a hot, burning question for me. What's the burning
behind
question?
the scene, yeah.
From what I heard, some people say. From what I heard, they say if you play enough with it, that itself prevent prostate cancer.
Play enough with what?
You know.
What?
We know what we know.
The shotgun.
What, shotgun? I don't
know.
have a shotgun.
You know.
Well, you mean the balls?
You and these balls.
He's stuck on the testicular self-exam.
I don't get this.
So
Your turn.
So no, I don't believe that according to science that's true, because I know a family. Some of the risk factors for prostate cancer are a family history of prostate cancer, being black. Sorry, fellas, that predisposes you. Morbidity. Morbid obesity. I turned obesity and morbid obesity into one word. Morbid obesity or even obesity, and being in poor health. So those things predispose you. And when you have early prostate cancer, at times you don't even have any signs and symptoms. Like we were discussing earlier, when you go to the doctor can turn around and do a rectal exam for you, which a lot of men don't like because they say, hey, I don't swing that way. Why is the doctor putting his finger up my rectum?
Is that the
What
test?
is he
Is that
testing?
the test when
Yeah.
the doctor do?
Well,
They go like
and
that.
you know what? You've had this thing with the glove. You keep talking about, the doctor snaps on the glove.
It's like blah.
The doctor just puts on his glove.
Oh, my bad. I don't know. That's what I'm used to. That's what I'm used to hear. They like, yeah, the doctor was like blah.
And then
Seriously?
you
see?
it's like they know what's you know what's
It's
coming.
like, you know what's coming. They're like,
So
my fault. So
yeah, no, it's just it's exactly an exam where they do put lubrication on their fingers and they're feeling for the gland, because the prostate is a gland, just to make sure that it's not swollen bigger than the size. I win.
Wow, guys.
But it's not swollen
Can
bigger
back in a second.
than
Can an individual check
their own.
their own prostate?
No, because you're not a physician. You're not trained to find it.
Now,
Would you
well-
like to go in because when they're doing it, they tell you to cough, right? Because that coughing induces a mechanism so that they can be able to feel it. Do you want to take your own fingers and go in there and perforate something?
No.
Okay, so you'd rather leave it. You'd rather leave it to the expert. Trying to find it.
Trying to find it.
No.
It's not so much. It's not only you have to put it in.
Side story. Listen, I had surgery, and the doctors turned around and told me I needed to do an enema twice a day. So what an enema is, just basically it's medication that you introduce per your rectum to help you move your bowels. Okay. The doctor turned around and said to me, "Can you do that for yourself, or can your husband do it for you?" I said, "I'm a nurse. I can do that for myself." How? Do you know you
I'm
have to
pretty
put
sure your
yourself?
husband would love to do it.
Said, "Do you know you have to put yourself in a position, and this is what you have to do?" Babe, did you ever have to do that
Nope.
for me?
Hell no.
Because here's the thing, I am a nurse, so I was able to do that for myself because I know how to do that for a patient. So imagine you're not a nurse.
You don't know how to
You're
do
not
that.
a doctor. As a nurse, I wouldn't be able to check your prostate for you. So he's a professional. Let the man do his job.
Exactly.
Okay?
Now, here's my question. Why is it always sound like it's a guy, it's the doctor, a urologist is always a man?
I don't know. Maybe there are females that are not interested in that field.
Yeah, because that's the scary part. Because it always sounds like
But
the urologist is always a guy.
wouldn't you feel better as a man going to a male
But
urologist?
the thing is, a gynecologist is always a man as well.
That's not true. There are a lot of female gynecologists.
No, I'm just speculating.
Who
I'm
just
not saying-
played? Who
Eve
just played?
just played, so it's my turn.
Okay, Eves.
But you know what I mean? I'm just saying because to me that's what it sounds like.
No, that's not true. That's not entirely
Okay,
true.
just making sure.
That's not entirely true.
I heard
So,
I had a lot of the guys like in the late 50s or early late 40s complaining about prostate cancer.
so it does start affecting. So lately, from what I've seen, prostate cancer is very common. Okay, there's more than 3 million cases in the United States every year. It's very common. And one of the reasons why we're seeing more cases is because people are being more proactive about their health. People are going to the doctor. People have health insurance. People trust in their doctors. They trust themselves to tell their doctors what's going on with their lives. And also, families are sharing more information. Meaning, if your mom had breast cancer, your mom's telling you, "I had breast cancer," and then you're sharing that with your doctor, and your doctor's putting it down in the records so that tells them if your mom or your sister or your aunt had breast cancer, that would put you at a higher risk of prostate cancer. So they're testing you sooner. They're testing you more often. They're keeping an eye. And then another thing that causes these men to have these tests is, as everybody at the table is, and as everybody in the Domino Effect crew currently is,
Black.
everybody's married. So the wives are encouraging the husbands to go and get tested, to go and see their doctors. Because most studies that I've seen show that more married couples, the wives want their husbands to live longer. Therefore, they're encouraging their spouses to go and see the doctor.
I heard sometime, I don't know if it could be some people might be ignorant on those aspects. So when somebody say, "I have prostate," and some people say, your wife don't do the job or you don't do your job, because most of the time they say to reduce prostate, the more you having sex, the more you go to that can reduce.
Unfortunately, that's a misconception. Because I think
My turn?
that's a huge misconception. Because if you're looking at it, I do know somebody with prostate cancer currently, and if I were to turn around and say, "This man gets around, this man does what he needs to do," he does.
But at the same time, there's another misconception where it says, "Oh, only people who are vagabond are the people that get."
So do you see
cancer.
those two cancel themselves out?
Okay, so which one is true?
Is it because you're a skirt chaser, that's why you have prostate cancer? Or is it because you're not getting enough?
Exactly.
So both of them are contradictions to each
which
other.
One is it? You know
so
what I mean?
that's not true.
or maybe people come up with that subject so
Just so they
their
can
own
be getting,
benefit.
exactly. That's what I was thinking. Just so they can get
So,
it from
guys,
at home.
while you guys are listening, that is the
Yeah.
reason why domino effect was created.
Exists.
That is the reason why domino effect exists, to make sure that we cover the misconceptions, the
that are out there.
misinformation that are out there. Please make sure to like the show, make comments, and share this show. Thank you.
So with prostate cancer, there are different stages. There could be stage 0, 1, 2, 3, and 4. 4 is the later stage where someone could ultimately, it can metastasize, which means that it can spread to other organs and other body parts. So with all the stages, there are ways to treat it. Some treatment can include surgery. It can include chemotherapy. It can include radiation. However, you don't want to leave it for it to get to stage 4, where the doctors have limited resources on how to treat you. So that's one of the reasons why I say, and why they say, an ounce of prevention is worth a pound of cure. So it's best to prevent something from happening than for you to turn around and say, oh, I'm going to go ahead and cure it, because it doesn't work that way.
Okay. The other question, it's like someone with a prostate.
He wins. Yeah, he fed the cabbages.
Yeah. Go ahead.
See, the other thing, someone with the prostate cancer, will it restrain you from a sexual active or
No. However, some of the treatments for prostate cancer can cause you to have erectile dysfunction. However, there are medications. There are medications that you can take. Once you have the surgery for prostate cancer, there are things that can be implemented, because not to be crude, like I've seen certain patients that have a prescription for a vacuum. It's a sexual aid vacuum that they would put on that would help them to get an erection, and they would use it. There are some patients with prostate cancer that end up with other cancers. So if a patient, there are patients that have had penile implants or penile pumps put in that help. So the technology is pretty much advanced, where there are different ways around that. When you have the surgery, sometimes you can have incontinence with the surgery. Sometimes there are infections. There are different complications that can happen with prostate cancer, with the surgery, and with the treatments.
Okay.
So it's not complication free, to tell you the truth.
Okay, so can a young person under 40 get prostate cancer?
Yes. And the reason why I say yes, if you have a family history.
Okay.
If you have a family history with men in your family having prostate cancer, and the women in your family having breast cancer and also having the BRCA gene, once they have the BRCA gene testing, if they have it, then yes, absolutely.
So by saying that, is that something that you think parents should be, made aware of, to talk to their kids? Let's just say, I have an 18-year-old, right? So is that something that should be, made aware of, talking to my son about, or just talk, if my son go to the doctors and say, hey, you may want to talk to because I may want to, if I found out that, okay, I have people in my family that have history of, prostate cancer.
That's definitely a conversation that needs to happen. And the reason why the conversation needs to happen is to make sure that the doctor has updated the records so that it's noted in the records to say, there's a family. Because with prostate cancer, not only is the doctor turning around and checking.
My turn?
Whose turn is it? Mine. not only is the doctor turning around and checking for the prostate gland, but if it's swollen, feels that it's swollen, it doesn't feel correct, the doctor is sending for imaging. The doctor's also sending for blood work to see what your PSA is, which is the prostate surface antigen, to see if your levels are normal. And if there's anything that's abnormal, the doctor's then turning around and sending you to see the urologist, for the urologist to do further workup, to do further testing.
Okay. Regarding treatment,
Mm-hmm.
can like a medicine like do you have to do surgery to remove the prostate, or you
So
can do
here's the thing. There are different things that can cause your prostate to be enlarged. It's called benign prostatic hypertrophy. That's when your prostate is enlarged, right? But it's not cancerous. That's why the word benign comes in. So they can put you on certain medications such as tamsulosin, different things. And when your prostate is enlarged, it causes your urine flow to not be as strong. It causes difficulty when you go to pee, for you to dribble a little bit, for you to not start peeing as well, for you to have some difficulty urinating. There are some medications that they can give to you to help with the flow. There's medications that they can give to you to see if they can reduce the size of the prostate. There's also what they can do is they can go in and take a piece of the prostate. You know, they can resection the prostate. There's something called a TURP, which is a transurethral resection of the prostate that they can do, just to because it was big. They found that it was big. They can go in and shrink it down to size.
So in another word, the prostate is like a mass that's blocking
It's a gland. So it can
is that a swollen gland, or
it
what?
can get swollen. Yes, it can absolutely get swollen. That's why I said the benign prostatic hypertrophy. That's when the prostate is swollen, but it's not cancerous. It's non-cancerous. But it's a urologist that would give the determination,
Of what,
that would come
if
up
it's
and
a
say what that
cancerous-
diagnosis is.
Okay, exactly.
You'd have to see a urologist,
So
basically.
you can just come out and
You
go-
can't come out and say,
Oh,
oh,
yeah.
my prostate is swollen, so this
Exactly.
is what I have.
Exactly.
No, you can't call the shots yourself.
Okay, so you can't just by feeling something and all of a sudden you think like, oh yeah. You
Yeah.
come
So
up with
someone
it.
that has prostate, is it that person?
Well,
constantly-
all men have a
Yeah,
prostate.
like but they develop prostate.
Develop prostate cancer?
Because you can't
You
just
have a prostate. You don't just develop it. You're born with it.
with prostate.
All men have a prostate.
Cancer, yeah, we develop.
So if you develop prostate cancer,
Is it a painful situation?
it can be. It can be. The urination can be difficult. The process can be difficult. It can be. It can be very painful. Because you can have bone pain, you can have pain urinating, you can have groin pain. It can be painful.
What about if someone went to going to pee and feel some burning sensation?
So burning sensation, full disclosure, you need to see your doctor, because it could either be that you have a urinary tract infection or you have a sexually transmitted disease.
Mm-hmm. Okay.
So you need to see the doctor. So I can't tell you this
so
is
it
your
has-
prostate.
Exactly. So
You
it
have to
has
see your
nothing to
doctor.
do
It could be anything.
Okay. Someone that going to pee
Whose
again,
turn is it?
and you're forcing your you're
with- How
peeing.
many you have?
5.
Okay, so
I got 5.
I got 5.
okay,
I'm the one that come out. That's my turn.
So it's your turn.
Wait, I got 6.
Oh, then it's your turn.
Yeah, that's okay.
Yeah, okay, that's what
Okay, someone that go to the bathroom trying to pee,
Mm-hmm.
but the pee coming out, but you have to push.
You have to force it.
Yeah, force it to for the pee to fully come normally. Is that a sign of
So-
prostate?
No, it could be a sign of anything. You have to see your doctor, because if you're having problems initiating a stream of urine, you have to see your doctor.
Question.
But now, now that you're saying, okay, now you said because prostate you have to do the test through your anal, right?
Yes.
So, what if you're having a hard time dropping deuce?
You have to see your doctor because it could be you're having a gastrointestinal problem. So, okay,
Why
you could be
everything when you can
constipated. You could be constipated.
Okay.
So constipation, that's a whole different specialty.
Okay.
You know,
No, I'm just asking.
a urologist deals with the urinary tract.
Okay.
A gastroenterologist deals with the
Yeah, I get that. But what
gastrointestinal
I'm saying
tract.
is, since they already in that little area there, so if you're having a hard time dropping the deuce, so
Do the work
You
behind
can,
you.
well,
You need to work.
Exactly.
you
You know what I mean?
can say that to them. You can say, "Oh,
hey, I'm
doc,
having
you
a hard
know."
time dropping the deuce.
You can
You know what I mean?
definitely
But
tell
okay,
them, you
at
know,
the
I
same
have an
time,
issue with
okay,
constipation as
at
well.
the same time,
But
if I'm dropping the deuce, right, and I realize,
bro?
come on,
whose turn is it? Because y'all
Okay.
are killing me here.
I just played.
Like
I got 2, 4, 5. So if I'm dropping the deuce, right, right, and as I'm wiping, okay,
and
if
you
I-
see blood
and
in
I
your
see blood
stool,
in my stool.
you need to let your doctor know, because blood in your stool could mean many things. It could be something that you ate. It could mean that you have hemorrhoids. It could mean that you're bleeding internally.
Okay.
That you have some irritation. You could have ulcers. It could mean anything. That's why I say anything that's not part of your normal, anything that's abnormal, you need to reach out to your doctor.
Okay.
This is another thing. I heard people sometimes when they talking, they say, "Oh, after sexual active and they have to go to the bathroom to pee, it's hard for the pee to come out." Now,
You forget you have one tube.
there's a blockage there?
No, you have one tube. The ejaculation, the semen comes out of that tube.
Yeah.
The urine comes back out of that tube. You
So they
just
both fighting. So you just
ejaculated out of
ejaculate. So
that
the
tube.
peeing is
So you need to give it a minute,
before.
and then it's the same tube.
Where the ladies don't have the same that kind of problem. See,
So,
that's bad.
guys, you see how how we're suffering?
Lord,
Do
why
you
did you do
understand?
this
Do
to
you
us, Lord?
understand when
my
I say
turn.
I need another lady at the table?
Let me see you. Let me see. Move. So, Nurse Pat,
Jeez. Yes, sir.
we really appreciate you coming and help us out and understand the situation. I know it's not easy for you to hang out with us.
Yeah, it's not easy being cheesy. I win.
I know it's not
Praise
easy.
God.
I know it's not easy.
I never pass.
Huh? I've only passed once.
Yeah, but I'm the one that come out.
I
That's
don't
your
know. I got
problem.
3 in my
Maybe
hand.
maybe
so.
you were so busy talking about the ball.
Exactly,
He has a lot of
talking about
questions about
questions.
these balls.
Exactly, these balls. So now,
Yes.
now let's just ask the question. I think you may have touched upon it, right? So if I go in the bathroom and I'm peeing, and all of a sudden I'm peeing blood,
That is one of the signs of prostate cancer.
okay. So,
But it's late stage prostate cancer.
okay.
So some of the
you
signs
know,
of late stage.
I just wanna we
Some of
hit
the
with.
signs-
Scared when you're at that stage?
Late stage?
Yeah.
No. The reason why I say no is because for every stage that you go through for all types of diseases, there's a process. Yeah, go ahead. There's a process, and there's diagnosis, and there are medications. This is not the time for you to panic. It's the time for you to pick up the phone, call the doctor, and say, "I'm urinating blood."
Take
And
control.
you also you do need to take control of your health. You also need to pay attention to what led up to this. Did I hurt myself? Is there anything else accompanying it? Do I have low back pain? Do I have flank pain? Flank is the side where your kidneys are, because maybe I injured my kidney. It may not be my prostate. Is there anything else going on? Then you need to pay attention. Is it bright red blood, or is it dark? Are there any blood clots? Pay attention, because the doctor's going to be asking you all of these things. Did this just come on all of a sudden? Or was this something that led up to it? Did I just not pay attention before? How much coffee have I had? How much fluid have I had? Could this be a
Or
little
how
bit
much
of the
beets
deep?
did you eat?
All of those play into that as well.
Okay.
Are my testicles swollen? When was the last time I did my testicular self-exam?
Play with your balls.
Do I have what are some of the issues that may be present? Because when you get to the doctor's going to ask you all of these questions. So it's best that you have the answers
That you're ready.
so that you're ready when you go, and know your medical history, know your family's medical history so that you can share it with the doctor. And this is not the time to be hiding information, because it's time to share information, because
Exactly.
it could save your life.
Yes.
Okay.
Well, Nurse Pat, I don't know what we would give to you for this beautiful session that you've done with us. You've touched upon things that I know most Haitian men don't want to talk about. I know that you touch upon things that a lot of church men don't want to talk about. And it was a pleasure having you talking about it. And I know we probably we said some word that, people probably never heard from us. And because, we made a point of not saying word that we don't normally say, but hey, we needed to make sure that, people understand where we were coming from.
Mm-hmm.
So, I don't know if you have any last word to say to our viewers before we close, because it is a good subject, and I wish we could do this in Creole for our Haitian viewers, but I don't think we have the time. But if you could say that would be good for us. Could you please tell?
So one of the things that I would encourage everyone watching this video, if you love a man, you have a man in your life, father, brother, son, cousin, co-worker, encourage them. Encourage them to go and get checked by their provider. If they have a family history of cancer, prostate cancer runs very high in the Black community. So it's best to get checked and get tested. Also, if you're having any symptoms such as difficulty urinating, passing blood in your urine, peeing blood, having lower back pain, having swelling in your groin or in your testicular area, or any other type of urinary symptoms, please speak to your doctor, because it could save your life. Because to be tested, like they say, an ounce of prevention is worth a pound of cure. It's best to prevent rather than to try to cure a disease. Si ou se haïtien, ou gen yon monsieur qui nan la vie ou qui se papa ou frère ou cousin ou zanmi ou ménage ou mari ou, encourage yo pour que yo capable wè médecin yo, pour que médecin capable tester yo pour prostate yo. Si yo gen nan famille yo gen moun qui gen prostate, qui fait prostate, li vaut mieux pour que yo capable prévenir, parce que prévenir vaut mieux que guérir. Si nous gen moun que nous remen, partage vidéo ça avec yo, traduit vidéo ça avec yo, parce que li capable sauver la vie yo.
Thank you for watching, and have a good night.
Good night.